Chapter. Hello, everyone. I know everybody's starting to join. We will get started in a second as people pop over from Dr. Little's session. Just a few reminders. CEU credits will be available. We will be sending out the evaluation survey at the end of the symposium. So by Friday, we will get that out to you guys through the email that you registered with. Once again, the chat will be open for questions. We will hold all the questions until the end. So feel free to ask them throughout it. And again, the recordings and PowerPoint slides will be posted at the end of the day after each day of the symposium. So if you're looking to see it, or if you've missed a session so far, they will be posted. So without further ado, we have Wykisha McKinney here. Wykisha's fight against suicide began with the loss of her brother, Johnny Madison, who died by suicide in 2004. Overwhelmed by grief after the death of her brother, Wykisha slipped into major depression, which almost ended with her own suicide attempt. With the support of her family and the help of local counseling centers, she was able to get the help she needed to cope with her loss and manage her depression. She also found hope and recovery in serving others that had been affected by suicide. Over the last 15 years, Wykisha has obtained a wealth of knowledge and experience in crisis intervention and suicide prevention, of which she is more than eager to share with others. Currently, Wykisha is the Zero Suicide Program Manager for the Harris Center for Mental Health and IDD in Houston, Texas, and the board chair of the Southeast Texas chapter of the American Foundation for Suicide Prevention. She's a highly sought speaker and advocate and has been featured in several documentaries, television interviews, books, and other publications. Recently, Wykisha launched her first business, the 20 Company, a tea company that donates 20% of its profits to suicide prevention. Today, Wykisha will be telling her own zero suicide story. And thank you, Wykisha, for being here today.
Thank you. Thank you so much for having me. And I will go ahead and get started in sharing the screen. And thank you all so much for joining us and participating in such a wonderful event over the past couple of days. It's been so helpful, and I've learned a lot. So I'm very happy to see so many people involved and interested in zero suicide. Get my screen together here. So I'm gonna share with you a zero suicide story. And my zero suicide story begins with my brother, Johnny. Johnny was a graduate of Texas A&M University. He was an advocate for Black LGBTQ community, particularly young men. He was a case manager for HIV positive men with a local clinic here in the Houston area. He was a complex guy. He was a wrestler and a cheerleader and loved anything ROTC military. He was in ROTC all through high school and also in the military corps at Texas A&M. And he was a devoted son, brother, and uncle. And as an uncle, he would say that's his most important role. He adored my son and enjoyed being able to spoil someone else's kid and then send them back to them. In today's presentation, we'll talk about, in this story, I'm hoping that you all will learn a little bit about the commitment to patient safety and a just culture of support for care and providers. That you all will have an understanding of what implementing zero suicide is and is not, and to also learn about the unique perspectives of individuals with lived experience in the zero suicide framework. A little bit more, to just share a little bit more specifics about Johnny's story before we go to the next slide. Johnny tested positive for HIV in 2000. And was diagnosed with AIDS at the same time. He lived with HIV for 3.5 years, had lots of complications with regard to medication, the diseases and infections that would take place, and just different, it took an emotional and a really heavy toll on him, physically and emotionally. In 2004, Johnny had attempted suicide for the first time once in December 2000. and again in 2004. So in February 2004, on February 5th of 2004, Johnny had gone to a routine appointment with his doctor to talk about his medication, some of the health problems that he was developing. He started to struggle quite a bit with his kidneys, and just to talk about what his plan of care would be moving forward. His T cell count was pretty low, and so they were really concerned about him developing more opportunistic infection and becoming sicker. And so he went to see his doctor that Thursday, February 5th, 2004. The doctor explained to him that they would really prefer to admit him into the hospital, considering the health issues that he was having. And the doctor, Johnny spoke with the doctor and explained to him that we were going out of town to visit our parents over the weekend. He and I both lived in Houston, and our parents lived in Dallas. And so we were planning a trip to go home to go visit our parents. So he explained to the doctor that he would prefer to be admitted, if he were going to be admitted on Monday, as opposed to being admitted that day and missing the visit with our parents. I saw my brother on February 5th. He went back to work after his doctor's appointment, picked up my son from daycare and spent time with my son. And I picked up my son from him that night. And the next morning, Johnny died by suicide. So on February 6, 2004, Johnny's story, and this combination of things, that kind of happened and took place is what kind of landed me here and in the work that I do, and in the information that I share with you all today. So as we go into this presentation, I would like for you to ask yourself, what if the clinic had policies that supported suicide care? What if the physicians were trained in how to identify and screen for suicidal thought or behavior? What if a safety plan was developed? What if there were official relationships between the hospital and the local mental health service providers back then? As a survivor of suicide loss, we ask ourselves, what if, a lot. And this question, in this place, I add power to this question because it helps to frame the value of the Zero Suicide Framework, because it answers the what if. It tells us what could happen if these things take place. It tells us what could happen, what the possibilities are if we add or tweak our policies and procedures in a way that could promote life-saving practices. So as we ask ourselves the what if, we can talk some more about the tools for zero suicide and how they fill in the gaps. The Zero Suicide Institute has a quote on their website. The Zero Suicide Framework is defined by system-wide organizational commitment to safer suicide care in health and behavioral healthcare systems. It represents a culture shift away from fragmented suicide care toward a holistic and comprehensive commitment to patient safety, the most fundamental responsibility of healthcare. The Zero Suicide Framework is not designed to point fingers at people, which is what's wonderful about it. And oftentimes when you implement new procedures or new practices, or when you tell your organization, we're going to evaluate how we do things, people may think that, oh, you mean you want to evaluate what I did or what I'm doing wrong. But the Zero Suicide Framework is designed to look at the system as a whole. And so what it does is that it looks at that system and it identifies where those gaps are. So one of the images that's used a lot is James Reason's Swiss cheese model, because it really shows how if things aren't lined up quite the right way, then there are holes in the Swiss cheese model that in the levels of Swiss cheese that could line up and allow a suicidal person to slip through and get to the level of serious injury or death. And so what if my brother would have been screened for suicide risk on his routine visit to his doctor, who was aware that he was HIV positive, who was aware that he had an escalation in his health problems, and who was aware that his health issues were getting to the point where we were thinking about and discussing end of life decisions. What if the hospital system and the clinics prepared their doctors, who all worked with HIV positive and folks diagnosed with AIDS, or patients diagnosed with AIDS? What if they were all trained in how to screen and assess and do a risk, how to screen and assess for suicide, and collaboratively create a safety plan? So what if they were able to connect Johnny to a mental health professional, either at the clinic, or even with a clinic, or even at a facility that they had a partnership with? So those would help to close those gaps, looking at the system and how the organization does things, how the healthcare system in and of itself does things. And so it is a culture change, and it is a culture shift. It's changing the mindset of how we view the value of our healthcare practitioners and our healthcare professionals and their roles in suicide prevention. As for some of you that may have sat in on Sade's presentation earlier, she mentioned that quite a few people, most people attend a medical professional before they see a mental health professional. So it's a key opportunity for patients to be screened and have a discussion about suicide. So the suicide framework helps to create change within the organization that closes these gaps and decreases the risk of a person becoming injured, seriously injured, or dying from a suicide attempt. And so while as a survivor of suicide loss, while I know, we ask the what ifs on a regular basis, and we always go back and ask the what ifs. I'm not in any way saying that my brother's medical professionals were responsible for his death, nor if they could have done, if they should have done, or going along with the woulda, coulda, shouldas of what they would have done would he be here today. What I'm saying is that the Zero Suicide Framework provides an opportunity to where the Johnnies of the future, or the Johnnies of today, have more opportunity to receive help and care throughout their time with their doctors. Another key component of the Zero Suicide Framework is engaging individuals' lived experience. Like myself, as a survivor of suicide loss, I serve in the role of the Zero Suicide Program Manager for the Harris Center for Mental Health and IDD. And as a person with lived experience, my perspective of the system, of the healthcare system and the mental health care system, is a little bit different. And from the inside, as a staff person, I can see both perspectives, the perspective of the organization and the perspectives of a survivor of suicide loss. And so for an individual, for those perspectives create benefits for both the organization and for the individual. The Suicide Prevention Resource Center provides a lived experience toolkit that helps to advise organizations on how to engage individuals with lived experience. And they list these benefits on how it is most helpful for both parties. For the organization, it creates an equitable workplace. It helps with quality improvement, as it inspires innovation to improve services, because from the perspective of a person with a lived experience, oftentimes our executives, and serving as a Zero Suicide Program Manager, sometimes our executives have a perspective of what may be happening, or an idea of what's happening, and it may be a little bit different from what actually is happening. And so engaging those with lived experience, especially those who've had experience with working through your health system, can help to open your eyes and enlighten you on how these systems that are embedded in our policies and procedures work. And so, as a person with lived experience, I might be able to share that, hey, when they screen me this way, or I noticed that when this happens, when my son was suicidal, or when my daughter was suicidal, or so on, that I didn't get a call back right away, and this is why, or this is what's happened. So those perspectives help to really improve the quality of services that's provided. It also helps with staff development in that it helps to develop employee and volunteer skills and their knowledge of suicide prevention beyond the theoretical and textbook learning. So it in a sense, much like this story, it puts a face to the name. And so it talks about you could show how if someone is learning about the PHQ-9, or if someone is learning about gatekeeper training or safety planning, then you can take the personal perspectives of that person with lived experience and ask them how a safety plan has affected them, or how that experience with safety planning really worked with them. And also for the organization, it builds community involvement. It helps us to build relationships of trust with the communities and individuals. It's important to know, well, not important to know, but still today, the most effective form of marketing is word of mouth. And so by engaging a person with lived experience in the work, you have someone who will spread the word to their communities about the good works that you're doing and the efforts that you're making, thereby increasing your services and your programs and increasing your impact on your communities. For the individual with lived experience, it helps us to develop our professional development, our professional skills and abilities. As you know, we can be placed in leadership roles and advise on leadership roles, or we could lead small community efforts, and really kind of help to enhance our professional development skills that could help us as far as our careers are concerned, or even if we intend to engage as mental health professionals one day, this would help us. It would help with our personal development as it transforms our painful experience into creating positive solutions. And for me, as a survivor of suicide loss, helping is healing. Helping was my therapy. Going to volunteer and assist others was so helpful for me. And it was so inspirational for me and so inspiring. And it helped me to put my own loss into perspective. As I connected with more people and built my social networks, and as I was able to develop more relationships with other individuals who were survivors of suicide loss and professionals in the field, or both, and really kind of carried me through and helped me to understand my purpose as a survivor of suicide loss and as an advocate for suicide prevention. So being able to help other individuals became my silver lining. And again, with community advocacy and building social networks, having an understanding of how organizations work and how the organization's programs and services work, I can then go and advocate for those programs and services to other individuals, to other agencies, and even go and do work or even go and speak with our public legislators and our government about the importance and the value of mental health services, of crisis hotlines, of suicide prevention work. And again, it builds a social network and social supports that are so important for individuals with lived experience. As a survivor of suicide loss, I can't begin to tell you how much I value the relationships that I have developed and that I have built with other survivors of suicide loss and other people involved in this work. I have some really great friends that I call family, and we work hard together and we play hard together, and it has been very, very helpful for me. And so in this toolkit, again, it also provides some insight on how you can engage survivors of suicide loss. Again, you can engage them on the leadership level, and you can also engage them just in surveys and evaluations and focus groups, things that you can use to evaluate your programs and services and how you do things and how effective they are. For me, I came full circle when I became the program manager for the Zero Suicide program manager for the Harris Center. The Harris Center's work in zero suicide is a part of the Texas Suicide Safe Care Model and zero suicide and the Suicide Care Initiative. We have a 3-part, we always do things big in Texas. And so this is a big initiative that we are addressing that we are implementing across the state. And so this particular component that I work with is a part of the behavioral health systems component where we are encouraging local mental health agencies across the state to implement zero suicide. We have 4 regional suicide care support centers, one being the Harris Center, where we provide technical assistance and training to our fellow mental health agencies who are wanting to enhance suicide care and implement zero suicide within their agencies. We're helping with developing pathways to care, effective interventions, are providing samples for policies and best practices, and really doing a lot of great work to ensure that our behavioral health centers are suicide safe care centers. And so for me, as a survivor of suicide loss, someone whose brother was actively involved in the health system and visited a healthcare practitioner the day before he died, I see the value of zero suicide. My personal story speaks to the importance of zero suicide. And I am fortunate that I am in a place where as I can share this story and this information and put a face to the name of zero suicide for you all. With that, I'm going to say thank you so much. And I will stop share. Well, I will keep the screen up for just a second, and then and we'll put it back up. And I will stop sharing so that so we have a few minutes to take questions.
Thank you, Wykisha.
Thank you.
We do have one question in the chat, and again, if anybody has any questions right now, feel free to put it in the Q&A area. Chelsea would like you to speak a little more about the gatekeeper training, as she's not familiar with them.
Okay, so there are a few gatekeeper trainings that are available. The Zero Suicide Institute, if you visit their website, they have a listing of recommended trainings. There's a couple of gatekeeper trainings like ASSIST, Applied Suicide Intervention Skills Training. Safe Talk is another. That's ASSIST and Safe Talk are both provided through Living Works. And in Texas, we have the ASK training, AS+K, and it is Ask About Suicide to Save a Life gatekeeper training. These trainings are designed to train individuals on any level, whether it be community liaisons or even our mental health professionals, on the basics of the warning signs and the risk factors of suicide and how we can help someone who is in crisis at that moment.
Yes, and if you are located in New York, if you want to check out the Suicide Prevention Center of New York's website, it's preventsuicideny.org. We also offer various trainings that Wykisha just mentioned, so you can check out the websites, and we will, you can email us directly, spcny@omh.ny.gov, if you'd like some more information, again, if you're located in New York.
Are there any other questions or comments?
How do you navigate people wanting to ask you personal details of your brother's death? It is so important to share a personal connection to suicide loss, but I find some people struggle with boundaries.
Yes, you are absolutely right. There are people who struggle with boundaries. I think it is a natural curiosity to want to know the details. Some people are just nosy, and they do want to know the details. For me, as a survivor of suicide loss, I'm very direct in saying I do not feel comfortable with sharing details of how he died. I'd rather focus on how he lived. And also focus on what we're doing right now to help others who may be having those same thoughts as he had. So I kindly say, no, I won't share that.
Do you think it is appropriate for providers to tell clients about their personal losses?
I'm not a mental health professional and I'm not a provider. So I will say that. I will say that sometimes it might be a little helpful to say, you know what, I understand what you're experiencing or what you're going through. Here is a helpful resource that I found to be helpful. If it is just a matter of, I think it's within the context of why the provider is sharing that information and what for. I definitely think it helps as a survivor of suicide loss to know that someone understands. But what's more helpful is that someone understands and has some information to help me through my healing process.
Any other questions? How has your healing journey been transformed through this work?
So, through the zero suicide framework and really just kind of understanding, prior to getting involved with the zero suicide framework and this particular work, a lot of the work that I did was community based. Right. And so it was more so out in the fields, working with different community based agencies or just working directly with the people. And as I got into this role, I look at it as more of a leadership perspective as far as changing systems. And so both roles are very important, and getting involved in the community and sharing information directly with the community is very important. However, in this particular role, I'm changing systems to improve care for those in the community. So as they are educated and they become more aware of the services and the help that is available, those services are ready to help. And so that's kind of how it's changed, how my role has evolved, and how it has helped me in my healing journey is really just having more of an understanding of what can be done. And I feel very motivated that organizations are working on this level to improve their systems to save lives. So I don't feel so alone in doing the work. And we all know that we know that in Texas and in as well, there is limited access to mental health care in certain areas. However, if we're all on the same page about how we save lives, we can save more. So that motivates me to keep working.
Thank you. And I'll let you read the comments in the question area. They're for you.
Okay.
Any other questions for Wykisha today? All right, well, that wraps up our day 2. Again, thank you, Wykisha, for your time today. We really appreciate it.
Thank you.
Very inspiring. If anybody has any other questions, feel free to reach out. Just a few reminders, again, CEUs, they will be offered, CMEs will be offered. The evaluation will be sent out at the end of this week. Tomorrow will be our last day, day 3. So join us please again for some great speakers, and a closing tomorrow afternoon for a call to action to speak a little bit more, very similar to what Wykisha and her team in Texas are doing. So please join us tomorrow as well. And in addition, some other things to check out on the platform. There are some exhibit halls and some resources available, including our zero suicide implementation guide that we've created through this work. So please, again, take a gander around the website to check out more. And again, the recordings will be posted after. Again, thank you again, Wykisha. We really appreciate it.
Awesome. Thank you all so much. Have a great day.
Have a good one.
Bye-bye.